Hello, I'm Dr. Rohan Khandewal. I'm the lead consultant and head breast surgeon at CK Birla Hospital Gurugram. So breast cancer is now the most common cancer all over the world and also in India. It has surpassed cervical cancer, and the incidence of breast cancer in India, as per the latest figures, is that 1 in 21 Indian ladies will develop breast cancer during their lifetime. And it is said that by 2030, we will reach the Western figures of 1 in 8 females developing breast cancer. So the incidence is definitely on the rise. So breast cancer diagnosis and presentation has changed a lot over the last few years. When I started practicing, at that time we used to get patients at very advanced stages and the lumps were very big. So we could easily biopsy them. And also at that time, FNAC, that is fine needle aspiration cytology, which is using a very thin needle to get tissue, was practiced. Nowadays, we rely on core needle biopsies where we use a thicker needle to get tissue out of the cancer. Now, because patients are coming to us early and we also have a lot of screen detected cancers, that means patients go for preventive health checkups and they are picked up with lumps. So in those cases, we have to do image guided biopsies. So we do them either under mammographic control or under ultrasound guidance or using MRI. So this has been a major change in the diagnosis of breast cancer over the last few years. Also, PET scan, which is a whole body scan which is done if a patient is diagnosed with breast cancer. So that tells us the stage of the cancer, where all has the cancer spread. And just to elaborate on the biopsy techniques, one major change has been the use of VABB, that is vacuum assisted breast biopsy. So vacuum assisted breast biopsy can be used both for the diagnosis of breast cancer and also for removal of non-cancerous breast lumps. So like I said, VABB stands for vacuum assisted breast biopsy, and this is one of the recent advancements in breast biopsy techniques. So this machine has a gun attached to it through which we can take a biopsy, and it also has vacuum attached to it. So that tissue is sucked into the container. So the advantage of VABB is that it gives us a bigger chunk of tissue to confirm the diagnosis in breast cancer patients. And in non-cancerous lesions like fibroadenomas, which are very common in young ladies, this breast biopsy technique can be used to remove them in a scarless manner. So with VABB, we can remove them with just a 2mm incision, and once that heals up, you can't even make out where the cut was made. The advantage of VABB also is that we can remove multiple non-cancerous lesions through a single small incision, and this surgery can also be done under local anesthesia. That means the patient does not need to get general anesthesia. Even as an outpatient procedure, these surgeries can be carried out. So we at the Breast Center at CK Birla Hospital have been pioneering VABB technique for over a year and a half now. And during this period, we've done more than 100 cases of vacuum assisted breast surgery where we've removed non-cancerous breast lesions, that is fibroadenomas or ductal lesions, in innumerable young girls without any scar. So that is the advantage, that it is truly scarless, and when we see these patients after a month or so in our OPD, we can't even make out where the cut was made. We do these procedures under ultrasound guidance, and I want to stress on this point that all the procedures are done under ultrasound guidance, so that ensures that the entire lump is removed and nothing is left behind. So that is the advantage, that we know on table that we've removed the entire lesion and in a scarless manner. We follow up these patients routinely by doing ultrasound scans after 6 months and 1 year after the surgery. So the future of breast surgery, the theme which is in vogue these days is that less is more. And that is the beauty of VABB as well, that with a very small incision, we are removing multiple lesions and in a painless and a scarless manner. In future also, breast surgeries would become less invasive, and we would focus more on cosmetic preservation after removal of the disease.